The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone. Thank you for joining us today for our webinar entitled Preparing for a Medicaid Promoting Interoperability Program Audit. Today's presenter is Bruce Mackey, MCEDA's Regulatory and Incentive Program Analyst. My name is Liz Jones, and I am today's moderator. Before we begin, I have a few housekeeping items to touch on. We will be keeping the phone lines on mute during today's presentation. If you have a question for Bruce, please type it into the questions box in your GoToWebinar interface. We'll take time at the end of the presentation to answer any questions you have. If for some reason we are unable to get to all of the questions, we will email you directly with an answer following the broadcast. We will be posting the presentation slides and a recording of today's webinar on our website, www.mceda.org. Also, the presentation slides, along with some other helpful resources Bruce will describe during his presentation, are currently available for download in the Handouts section of your GoToWebinar interface. Today, Bruce will discuss the Medicaid Promoting Interoperability Audit Program, reviewing what you can expect in the notification process, how to review the attestation that is being audited, the supporting documentation that is likely to be requested by the auditor and how to submit it, as well as how and when to communicate with the auditor to ensure the process goes smoothly. He will also discuss what to expect back from the auditor once a determination has been made. Lastly, with any time left, he will address questions posed by the attendees during the broadcast. Please note, the information you will hear in this broadcast is current as of today and is only intended to be a general summary. With that, I will turn things over to Bruce.
Thank you, Liz, and thank you everybody for joining us today to discuss the Medicaid PI program audits. So why don't we dive right in? So we're going to start with a high-level overview of the process itself. This was required under the Medicare and Medicaid EHR Incentive Program final rule way back in 2010. And this was actually the piece of legislation that enacted the incentive program originally, the whole meaningful use program for Medicaid. MDHHS audits follow a CMS-approved plan, ensuring that audit processes follow guidelines put forth by CMS. Random audits are a sample of submissions for a given year. So they're kind of the luck of the draw situation, or unluck, as the case may be. Targeted audits are triggered by information included in the submission, such as public health exclusions, there's a mismatch of data between attested numbers and reports, manual calculations that are done that kind of step away from those printed reports out of your EHR, stuff like that could trigger a targeted audit. Currently, MDHHS is wrapping up program year 2018 audits, and they've also begun launching 2019 and 2020 audits. And I know a lot of you have probably received those audit notifications just recently that are targeting some of those 2019 and 2020 audits, or those program years. If you're an organization with many providers, this could mean responding to numerous audits at the same time. The notification from MDHHS email that it identifies the provider as well as the program year that's selected for the audit. I've included a link to the federal registration login page here on your screen. We recommend keeping the email address associated with providers updated, even though the program has ended, so that any program communications, including these notifications, get to someone appropriate. We highly recommend using a generic email address, such as incentives@organization.com or something like that, so that it can be easily transitioned from person to person in the event of staff turnover. Or perhaps it could go directly to the provider, so long as that email address is actually monitored. Too many times the email used is the practice manager or a similar role, who then leaves, and the email for that person is no longer monitored. Thus, you're not aware that a clinician is being audited. Again, this happens quite a bit. So you really want to make sure that the email address that's in that federal registration system is kept up to date, because that is the email address that is used through this whole process. The email will include an attachment that contains the deadline for submitting the response, as well as directions of where and how to upload, which I will go through in more detail in the following slides. It also includes a list of requested documents. Commonly requested items are listed on this slide, and we'll take a deeper dive on those today as well. Others that are not as common, but may also be requested when applicable, are additional documents that prove that an FQHC is in fact PA-led, and documentation for pediatricians if CHAMPS doesn't have their specialty listed as such. And here's a pro tip for you. Be proactive and pull these items together now if you haven't already. Don't wait until an audit notification is received. Get that stuff built right into your audit file right now if you haven't already done so. So if you've received an audit notification, so now what? What's the next step? Well, the first step is in preparing to respond is to review the submission under audit. Know what is being submitted and know what you are supporting and or defending. To review, you'll need to access the EHR MIP application where the attestations were entered via CHAMPS and log in under the track option. Step-by-step instructions for accessing EHR MIP can be found as part of the reviewing previously uploaded documents in EHR MIP tip sheet that's available right now for download in the handout section of your GoToWebinar interface. Once in EHR MIP, you'll want to review the eligibility tab for encounter information used with the submission and the meaningful use tab to confirm the reporting periods that were attested to. You'll also want to navigate to the Upload Documents tab and download any documents that were submitted at the time of attestation by selecting the green arrow icon. Any document previously uploaded, such as Medicaid patient encounter reports or public health active engagement letters, don't need to be submitted with the audit response. Rather, we recommend that they be downloaded so that you can review what has already been provided to know what is appropriate and to determine what will need to be submitted for the auditor's review. However, if you do submit these documents again, it's okay. It's just added work that's not really needed on your part. The documents will also include an attestation summary document with details of the measures attested to and exclusions taken. Again, another way to know what was submitted and what will need to be supported by additional documentation. Before I get into a closer review of the various documents, let's cover some helpful tips to keep in mind. We've also created an audit response documentation checklist to help organize your documentation needs, which is also available in the handout section of your GoToWebinar interface. So one thing you'll want to do is create a folder in which to save all the documents that will need to be uploaded. This separate folder helps to ensure that you're grabbing the correct documents when submitting your response. You'll want to name files in a way that mirrors the audit letter verbiage and or describes the content. File name examples might be Purchase Agreement 2018 Epic or Drug Allergy Interaction Screenshot before reporting period, Drug Allergy Interaction Screenshot after reporting period, stuff like that. Anything that really describes what that document is in full, so that just that title alone is going to tell you and the auditor exactly what's contained in what data to expect in that file. You want to ensure that all documents are saved as an acceptable file type as well, and then identify that functionality shown and the dates for the auditor so there is no question as to what the screenshot is showing or that it applies to the reporting period under audit. And also follow the minimum necessary policy and avoid sharing patient identifying information when it's not necessary. So you want to redact that from your reports if you can. Next, we'll take a deeper dive on the supporting documentation itself. For the Certified EHR Technology Contract or CERT contract, this should indicate that the CERT was available during the reporting period. Best case scenario is if it also shows the provider's name, but it has been accepted with the practice name that ties to the payment location. You'll need eligibility reports that include both Medicaid and total patient encounter details. The audit letter includes an example of the format for these reports. You don't have to match the format perfectly, but should contain at minimum the information listed on this slide. For the objectives and measures and CQM reports, these should have been uploaded at the time of attestation, but you may need to provide additional documentation for any manual calculations that were done. If the CQMs were reported electronically via a QRDA file, then a CQM report is not required to be uploaded. Under clinical decision support interventions and drug-drug and drug allergy interactions, that's a minimum of 5 CDS interventions, not including the drug-drug and drug allergy interaction checks. CDS may be a pop-up notification, it could be colored text signifying patient needs, a section of the chart that identifies those gaps in care, anything that prompts providers for that patient care. Documentation used as proof must show that the functionalities were enabled for the full reporting period. So keep that in mind as well. For the security risk analysis, your SRA, you're going to want to upload all pertinent documents from the analysis conducted during the program year. If you had an SRA with us, there are 3 separate documents. Other SRAs may have more or less depending on how they're formatted. You'll want to submit proof that action was taken to mitigate identified risks as well. This proof could be a corrective action plan with updates documented, meeting notes demonstrating steps taken, communications with your IT vendor, or the following year's SRA that shows fewer identified risks, meaning some were resolved. So it's not enough just to conduct the SRA and prove that you did the SRA. During your audit, you're really going to have to show that you're working on anything that audit, that security risk analysis identified as being an issue. Again, it's not enough to just have it done. You've got to be working on anything that the SRA identifies as well. For public health and clinical data registry active engagement, there are various types of documents listed here that could substantiate active engagement, but whatever you use must show the name of the registry, the provider or an organization, as well as the date and status of active engagement. As previously mentioned, if this documentation was already submitted during the actual attestation for that program year, you don't need to submit them a second time for the audit. But again, no harm is done if you do submit them again. For justification for exclusions used, this could be typed documents explaining why exclusions were taken. For numeric measures that allow exclusions for volumes under 100, this is only necessary if the exclusion value is different from what is on the CERT report, perhaps detailing circumstances of manual calculations or perhaps incorrect CERT data capture, which still happens from time to time as well. For public health exclusions, you're explaining why a provider was not engaged with the 2 required public health registries or clinical data registries. The final item needed is a signed and dated attestation of supporting documents form, found as the last page of the audit letter. This statement certifies that the documentation being uploaded is complete and accurate and is in acknowledgement of understanding that an unsatisfactory outcome will result in payback of incentive dollars received. So once you have all of your documentation pulled together and saved in that separate folder I discussed earlier, the next step is submitting it all for the auditor's review. This is done in the EHR MIP application on the Audit tab, in the Audit Details window as shown in the screenshots, not the regular Upload Document tab that was used during attestation. Submitting via the Audit tab notifies the auditor that documentation has been provided for review. The Upload Documents tab does not do this, so the auditor does not know to look there for newly submitted items. When submitting documents on the Documents tab of the Audit Details window, you will browse for the correct file, select a file type from the drop-down menu, and enter a description. You'll want to select the file type that most closely matches the document, but know that many will be classified as other supporting documents. Utilize the description field to tell the auditor what the document is specifically supporting. Use of an effective description can prevent questions or requests for other documentation from the auditor. The page allows you to to upload 3 documents at one time, so it's likely that you will need to repeat the process multiple times to upload all required documents. Detailed step-by-step instructions of this process are also available in your GoToWebinar interface in the tip sheet called Uploading Support Documents in EHR MIP. You might find that helpful as well. There are a few tips to keep in mind as you're submitting the documentation. If possible, upload everything at once. This may prevent the auditor from reviewing early and requesting additional documentation when you haven't completed the uploads yet. If an incorrect document is uploaded, it should be deleted by selecting the red X to avoid confusion. For easier review of the documents submitted, change the number of documents that display per page, and remember that you may still need to view a second page to confirm they've all uploaded correctly, depending on how many documents you have to submit. Timely communication is key to a successful audit response. When an audit notification is received, it is helpful to confirm receipt and acknowledge your intent to respond. This allows the auditor to know that the contact information for the provider is accurate and that a submission will be completed. If you're nearing the submission deadline and are still awaiting documents, upload everything that you have and then email the auditor with details of what you're still waiting to complete and upload. Typically, as long as there has been some communication, the auditor is able to grant an extension period. So, if needed, don't hesitate to reach out and keep those communication lines open with the auditor. It really does help things run smoother. It's also recommended that you send an email when all expected documentation has been submitted. This signals the auditor that they can begin the review instead of waiting for the initial or extension deadline to pass. Lastly, make sure to monitor for a response from the auditor, as they may request additional documentation or have questions about what has been submitted. Much like the initial audit notification, results notifications are sent via email once a final determination has been made. Again, these are sent to the email associated with the provider's federal registration, which is another reason to keep it updated. The results notification email will not include the audit determination and instead will provide instructions to log into the EHR MIP application to view the outcome. The determination can be found on the Audit Details window as seen in this screenshot. Unsuccessful audits will result in recoupment of incentives paid. This is typically done through Medicaid claims adjustments until the incentive value, $8,500, has been fully recouped. In certain circumstances, such as when a provider no longer receives claims payments, MDHHS may send a letter via mail with other recoupment methods. Should the provider not agree with the audit determination, an appeal needs to be filed via the EHR MIP Request and Appeals tab within 30 days of the audit determination email being sent out. So there is some recourse if you don't agree with the audit determination, but you do need to make sure that you signal that within 30 days of that determination being made. Here we've got a couple of resources for you: the Medicare and Medicaid EHR Incentive Program Final Rule, the one from way back in 2010 that got this whole thing rolling. The CMS Promoting Interoperability Programs Registration System, that is a good one to check out as well, and the Medicaid PI Program State Level Registration Guide for eligible professionals. And some of these might already be familiar to you as you've used them through the attestation process. So that's it as far as content goes regarding the audit. Hopefully you found some tips and tricks and these screenshots and certainly those handouts in your that you can download right now, along with the slides in your GoToWebinar interface, should be of help to you. Before I open things up for questions, I'd like to take a moment to invite you to stay connected with Altarum. As the MCETA program comes to an end, we have a number of other great quality improvement programs gearing up to work with practices just like yours in 2022. If any of these sound beneficial to your practice or providers, please reach out to enroll. We have the Healthy Hearts for Michigan program, otherwise known as HH4M. We have MySpark as well, the Michigan Sustained Patient-Centered Alcohol-Related Care. And then ROMPO, the Reframing Optimal Management of Pain and Opioids in Older Adults. Again, we would love the opportunity to continue to work with you and improve things in your practices and really just help you out with that patient care. We've got 3 different programs here that might be of interest to you. So please reach out if we can help. With that, I will open things up for any questions. I do not see any coming in as of yet through the questions box if you go to webinar interface, but I'll pause here for a moment before we wrap up for the day and see if anything comes in. Certainly, if we can be of help after this webinar with regard to any audits and audit notifications that you've recently received, please don't hesitate to reach out to us. You've still got us for a few more weeks. Unfortunately, our contract with the state of Michigan is going to end at the end of this year, and so we will not be available to assist with audits after that time. But certainly between now and the end of the year, if there's anything that MCEDA can help you with regard to the audit process, don't hesitate to reach out. We love helping you. It's why we're here. So you can shoot those questions over to us or just give us a call. We'd be happy to help. Again, I don't see any questions coming in, so hopefully that means that you've got all your questions answered and you found the information here to be helpful and will help kind of guide you through this process. I know it can be sort of daunting when you get that notification of audit, and so just follow the steps. Just make sure you stay in communication with your auditor. They're not there to try and fail you. It's really just the opposite. They're doing their due diligence to ensure that all the T's are crossed and I's are dotted, but they really do want to see you pass this audit, and they're really going to work with you to ensure that that you get a positive determination here. They do not like recouping these funds. I know that for a fact. So just work with the auditor if there's any struggles, and you'll find them to be really easy to work with, and will do whatever they can to get you through that process and hopefully to a positive result. All right, with that, we're going to wrap up for the day. Thank you so much for joining us today, and I hope you have a great holiday season and a Happy New Year.